my name is Brenda Munoz, and I'm a physical therapy assistant here at Joaquin Rehab Hospital, and I'm here today to talk to you about traumatic brain injury, or TBI. Traumatic brain injuries happen 200,000 a year here in the United States. Traumatic brain injury is a brain dysfunction caused by a blunt force injury to the brain. There are 4 types of traumatic brain injury. The first is concussion, and those happen by the brain shaking within the skull. You think of your whiplash, maybe your soccer player that headbutts the ball to make the goal, that's your concussion. Not recognized as often because a lot of times they don't come with a scrape or any type of outward wound look, but still creating damage to the brain. The second is a contusion, and that is a bruise to the brain. A little harder impact, a lot of times that will have an outwardly scar or some type of wound. The third is a penetrating injury, and that's when the skull is actually fractured and something penetrated the brain. That's your bullet wound, that type of thing. The fourth is a anoxic brain injury, and that's where the brain is starved of oxygen. That only takes 4 to 5 minutes for that to start creating brain damage. So those are the basic 4. What do you expect symptom-wise with traumatic brain injury? It can vary. It can be sleepiness. Maybe there's memory issues, confusion with normal things. Maybe they pick up their phone and they normally scroll through and get right to where they want, but they kind of get stuck and can't figure out how to get to the next step. Maybe it's thinking and processing and sequencing. I think about that is as if you walk into the room and you can't remember why you were there. We all do that, but luckily that's one time. If you imagine your whole day being like that, how frustrating that would be. And a lot of times with that frustration comes across towards family, maybe towards co-workers once they've returned to the workforce. So a lot of times outbursts and things happen directed not at the correct person, just out of frustration with changes and things that they feel like they should be able to do, but they're not able to do as smoothly as before. Other things, speech and language can be affected. There can be swallowing issues. Bowel and bladder can be affected. They might have weakness on one side or both sides of the body, decreased coordination. Most of those things, the recovery time, that varies. It can be months, it can be years. So it's a battle that you want to just keep fighting to get better, no matter what stage you find yourself in. Unfortunately, there's no recipe that says at 6 months you're fully recovered. It's a day-to-day fight and struggle, and you just got to keep working. For what we do here at San Joaquin, our goal is to get that patient or that person back to their life roles. What does that mean? Our life roles revolve around schedule, so that's where we start. We get the patient up at a certain time. We have meals at a certain time. They have therapies at a certain time. They know PT's coming in at 9. They know OT's coming in at 11 or whatever. If speech is involved, we get speech scheduled at a certain time. We have rec therapy coming in. Families coming in to help kind of coordinate what are their likes, their dislikes, so that we can keep them involved and engaged in their day as much as possible, with the downtimes and the rest as needed, because obviously they're healing. So that's kind of what we're working towards. Again, getting them home. That's our goal, but home safely. So home doesn't mean they immediately return to everything. Home means they return to what they can do safely, and the family's help guiding them. Outpatient is helping guide them, or home health, whatever's appropriate. Thank you.